Welcome back to part 3. In the part 2, we have been discussed about quality of physiotherapist. And in the part 3, we're going to discuss about how does sports physiotherapy help athletes in enhancing their performance. When these questions were asked with athlete, they responded that the sports physiotherapist help athlete to recover from the injuries, and also they help in preventing the injuries, has been described by Woods et al. In the year of 2012. Now, let's move on to sports physiotherapy standard. So, what do you mean by sports physiotherapy standard? Standards have been written to describe the specific ability and behavior of a sports physiotherapist in a defined context. That means standard. The standards will enable sports physiotherapists to provide evidence of their competency, which means efficiency of a sports physiotherapist, and which will identify further learning needs. So what do you want to know more in field of physiotherapy in order to improve your competencies? The standards have been described by International Federation of Sports Physical Therapists. Now, let's look at the standards of a sports physiotherapist has been described by Bully and Donaghy et al. In the year of 2004. It has been classified, the standards have been classified into 6. What are they? The one is foundation of knowledge. Now, the critique and synthesis. Now, information collection, action and intervention, evaluation and modification. Now, let's move on to detail one by one. What do you mean by foundation of knowledge? The foundation of knowledge means that the sports physiotherapist demonstrate the ability to recognize sports specific demand. The demand of the sports which will vary from individual sports to other sports. So we'll be able to demonstrate the ability to recognize sport specific demand and their potential effects on healing as well as pain process. That's called foundation of knowledge. Also, we'll be able to discuss the impact of coexisting and pre-existing pathologies. For example, if a player, those who presented with a low backache, always we have to have a post-medical history. Whether do you have the same episode? Did you have the same episode ever before, or is there recurrence? So, when you discuss about the impact of coexisting and pre-existing pathologies, which helps sports physiotherapists to identify the causative factors, and we will be able to identify the potential impacts of various factors on recovery process. Also, it will show us insight into the biopsychosocial impact of injury, and it helps us to identify the clinical and performance related assessments techniques. So in the foundation of knowledge, also it helps us to recognize the relevance of medical investigations and inferences, and also identify the current investigations like MRI and X-ray. Now, what do you mean by critique and synthesis? Again, the sports physiotherapist demonstrate the ability to critically analyze the current research into measurements and interventions. Mostly, the critical thinking and synthesizes used in rehabilitations and appropriately integrate the new innovations into a practice, like what we have seen in the previous slides. So whatever the knowledge that we acquire, so the new knowledge, innovation, and put into a clinical practice. That's called critic and synthesis. What do you mean by information collection? Again, the sports physiotherapist demonstrate the ability to collect the existing information relating to the athlete's conditions. Also, we should obtain the client history, the athlete history, using recent selection of questions. So we should avoid unnecessary questions shoot out to the athlete. So always we should have a recent selection of questions so that it helps athlete to answer the questions. Now, the information collections which will always relating to athletes, priorities and goals. It also help us to assess the severity as well as duration of the pain by using severity of the pain by using visual analog scale, and then durations to identify whether the pain is acute, subacute or chronic. Also, it will make us to observe and analyze specific sporting movements. Now, let's move on to evaluation and modification. What do you mean by evaluation and modification? The evaluation and modifications means that modify the use of clinical and performance related testing to provide the most appropriate informations at the different strategies in the rehabilitation process. So as been described by Bully and Donaghy et al., these are all the standards of sports physiotherapy which require to be an efficient sports physiotherapist in a multidisciplinary team. Now, what is the relationship between the coach, athlete and physiotherapist in a multidisciplinary team? When you talk about relationship between these three, we should have a mutual relationship in a multidisciplinary team, especially in a sports medicine model. We have a sports physician, orthopedicians, emergency medicine specialist, trainers, masseurs, athletes, and then coach. Here, our important relationship between these three is a key point to win a situation. Being a sports therapist, as I said, we need to have a good relationship. If you have a good relationship with the team, especially when you have a good relationship with the athlete and then coach, we have a feeling of mutual trust and confidence on each other. This implies that the athlete will feel that he or she can confide in the physio, and then physio will feel that the athlete will comply with the advice given. Now, what is the role of a coach here? The coach is responsible for athletes' training and performance, and it is vital to involve the coach in the medical decision-making process, because the coach is the one who is going to head the game. He is going to design the protocol, what is the role of each and every player. So it is always good to have a coach in the decision-making process. But sometimes the coach have a distrust of healthcare professionals in sport, and they sometimes have an opinion, rightly or wrongly, that the main role of the healthcare professional is to keep the athlete from training and competing. It is important for coaches to understand that the sports physiotherapist also aims to maximize and improve the performance and health of the athlete. Now, what is the role of a sports physiotherapist in a sports medicine team? Now, when you talk about sports medicine team, it's an umbrella, like it covers the entire thing. The umbrella of the sports medicine is divided into two. So, the performance and enhancement, injury care and management. So, who is the responsible for performance and enhancement, and then who will be responsible for injury care and management? It has been classified: the exercise physiology, biomechanics, sports psychology, sports nutrition, and strength and conditioning professionals. They help athletes to increase their performance enhancement, whereas emergency specialists, orthopedicians and surgeons, sports physicians, sports physiotherapist, sports massage therapist and podiatrist, they'll take care of injury care and the managements in a multidisciplinary team. Each and every profession has its own roles and responsibilities to support the team. Now, so what are the sports physiotherapy federations? As we discussed, International Federation of Sports Physical Therapy, that's called IFSPT. Already the competencies have been discussed. They have discussed about 11 competencies. What are the objectives of IFSPT? They promote sports physiotherapy worldwide, advance the professional interest and stature of the sports physiotherapy worldwide, improve the quality of sports physiotherapy worldwide through improving the knowledge, skills and professional responsibility, facilitate efforts to conduct research to promote evidence-based sports physiotherapy. Also, they promote international harmonizations in order to achieve the overall mission of the International Federation of Sports Physiotherapy. Now, all the sports physiotherapists in India comes under the Indian Association of Sports Medicine, which is affiliated to Federation Internationally Team Medicine Due Support, FIMS. And also we have Asian Federation of Sports Medicine, AFSM. Here are the references. You can go through the references. Now, on completion of part 3, we'll have assessment. Have included discussion as assessment. So, I request everyone to discuss about future of sports physiotherapy practice in India. Thank you so much.